Hello everyone and welcome to Community Connection, your window to the world around you. September is National Suicide Prevention Month, and given the Robin Williams suicide, the very sad tragedy of Robin Williams, we wanted to bring awareness to this extremely sensitive issue. And with us today, we have Dr. Tom Watkins, who is the Detroit-Wayne Mental Health Authority President and CEO. Dr. Watkins, welcome to Community Connection. Thank you for being with us today.
Siham, thank you so much for having me here today, and it's just Tom.
Tom, okay, sounds good, Tom. You have worn many hats. We're going to talk about your position with the Mental Health Authority, but you've worn many hats within your wonderful, vibrant, and effective career. You were you were part of the Wayne County Charter Commission, which actually sort of molded county executive government with Wayne County. You worked on Governor Blanchard's campaign. You were which I know you best as the superintendent for the state of Michigan's schools, and also the director for the Mental Health Association for the state of Michigan. So talk to us a little bit about your background. It's sort of mixed with business, legislative, and focusing on people with disabilities.
It has been. I grew up in Washington, D.C., in the Maryland suburbs, and saw people without a voice, oftentimes young people, minority individuals that didn't have a voice oftentimes within the system. And I decided at a very early age I was going to put myself in a position to change that, and primarily around young folks. I helped start Starfish Human Service here in Western Wayne County from scratch back in the 70s, my first job out of college many years ago. And I saw it really as a three-legged stool. If you care about people without a voice, and you want to provide a voice for the voiceless, you really have to have a heart for it and a passion to change. The second is that oftentimes the resources come through the public process. So be engaged in the political process, being aware of what's happening around us. Most of the dollars that come into Health and Human Services organization are either from a city council, a county commission, the state legislature, governor, Congress, and the like. So being engaged and being involved in that process. And the third is my business experience. I was the president and CEO of the Economic Council of Palm Beach County, Florida, the top 150 business leaders. In there to learn not only to do good, but to learn to do good well. If you're not managing the public resources in a sensible, thoughtful way, and ask yourself, if this was your money and mine, and ultimately it is, it's our tax dollars, would you spend it that way? And if the answer is no, then we shouldn't be spending it that way in the public side, because at the end of the day, it's maximizing limited public resources and private resources and the like for the public good, and that's really where I've been dedicating my life.
That's amazing. I'm just putting it that way and realizing that to affect change and to help individuals and especially the youth. And I know that you help create shelter and also for troubled youth, and also you had therapy for families. So knowing that through the legislative process is where you need to focus your efforts to be able to do those different things is a unique way of looking at it. I don't think a lot of people would really put that whole combination together.
And we have to work across the political lines.
Absolutely. And you're so right. It is all political.
At the end of the day, it's not about being a Democrat or a Republican. It's about providing high-quality community services, and that's where I've learned to work with people from the Democratic side of the aisle, the Republican side of the aisle. If you're interested in doing good for our community, I'm willing to step up and work with anyone in order to accomplish that. And I've been blessed over the years to work with Republican and Democratic governors, people on both sides of the political aisle in the legislative process, because there's a lot of good people that are trying to really make a difference in their local communities. And that's what, at the end of the day, it should be about.
Absolutely. Well, we got to talk about cloning next, because we need a few of you around there to have that kind of mentality and approach those things. You also worked with Wayne State University. It's my alma mater, but you worked with David Adamany as well. Tell us a little bit about what you did with Wayne State.
First of all, Dr. Adamany is somebody that I just adore in a professional way, capable, competent, focused, always looking to try to make a difference. He was an extraordinary president, and Wayne State is one of my alma maters as well, and so I have a tremendous affinity to that. Leadership matters, and Dr. Adamany was a leader, and Governor Blanchard, who I worked for, I was deputy campaign manager in his first campaign and served as deputy chief of staff, deputy director of administration in the Department of Mental Health, chief deputy, in the last 4 years as the director. But as many will remember, a funny thing happened on the way to that election in 1990. Governor Blanchard was expected to win, and he ended up losing 0.5%. So in 1990, at a fairly young age, I was out of work. Dr. Adamany reached out to me and said, Tom, I'd like you to come and help me do school reform. And at that time, my background wasn't in education at all. And I said, Dr. Adamany, I really don't know that. And his response was, you care about kids, you know how to get things done, come see me. I did. And the original concept that Dr. Adamany had is to bring the resources of the university, not just the College of Ed, but the law school, the medical school, the technology, engineering, to bear on the schools in our community, Murray Wright and the feeder pattern, the elementary and the middle schools that fed into that, not on a work on, but a work with the Detroit Public Schools to lift that up. For a sundry of reasons, sometimes there's politics that enter into this, that didn't become successful. Right about that time, the new chartered school law, and we're talking about the mid-90s at this point, came in.
And you were instrumental in starting one of these.
What we did is we worked and in essence created the forerunner to the chartered school, the University Public School at Wayne State. You know, if it walks like a duck, quacks like a duck, it's a duck.
It's a duck.
So it was one of the original, and we had over 6,000 unduplicated applications for 330 slots in a middle school in the city. And we were working very closely. But it really was a commitment of a leader from Dr. Adamany, not to just sit back and complain about what was happening to far too many of our children. Because a child today that doesn't get the education they need and deserve is going to become an adult without much of a future. And if you don't care about the children wherever they reside for the right moral reasons, you ought to care about it for your selfish self-interest. Because that child, without an education, is coming to your place of business as a potential employee,
absolutely,
a potential customer, or perhaps with some nefarious ideas in mind. So it behooves all of us to assure that all of our children, regardless of where they reside, get the education they need and deserve, because it collectively benefits us as a community.
For them to grow as healthy, well-balanced, contributing adults as well. So that's where it starts.
Absolutely. And it really was a commitment of Dr. Adamany to try to do something rather than, you know, what is it, curse the darkness?
Right.
Maybe light a candle. And Dr. Adamany and other leaders have been about lighting candles in our community.
Absolutely. I'm certainly a fan. I mean, he's done some amazing work. You know, the conversation about mental health and the newest tragedy, Robin Williams, who I just adored, and I know my son absolutely loved him, was very, very much inspired. I mean, he loves theater and he's a jokester, and he loves the comedy and the whole 9 yards. So it really hit him hard as well, because he thought this, you know, very well established, very successful individual who pretty much had the world at his fingertips, and yet he suffered from, you know, deep depression. And we just were talking about making sure that children have the right, you know, the right context to grow and to be successful. But how do you balance that with issues of mental health and it's really a chemical imbalance that, you know, we don't know how to address.
It absolutely is, and perhaps our U.S. Senator Debbie Stabenow puts it the best. Is we as a society have to care about just as much about the diseases from the neck up as we do from the neck down, as you pointed out, is that depression is an illness. It's not a weakness. It's not to pull yourself up by the bootstrap. It's an illness that affects far too many Michiganians and far too many Americans and people around the world. It's an equal opportunity disease. It impacts every community, every longitude, every latitude across this country. And the Robin Williams issue, is it pointed out, is your son. Got it. Here is this person. When you see him on the screen and TV and he's made money in his life, was so impacted, one, by depression, and two, oftentimes struggling with addiction throughout his career.
Does that go hand in hand
sometimes? It does, because people will try to self-medicate and using illegal substances or alcohol or the like in order to deal with their mental illness. But there's a few things we can do, is to try to use that tragedy, that loss of such great human potential. But we lose other human potentials that aren't on the big screen. Today, as we're speaking, somebody is probably so distraught, not getting the help, not getting the support they need, that they're contemplating taking their own life. And that's just as sad, because there is help. People can reach out through their church, their synagogue, their mosque, in order to get the help, to professional mental health people. At the end of the day, sometimes we talk about it as those people. Somebody that's mentally ill or somebody with an intellectual and developmental disability. But we need to keep in mind, this is our family members. It's our community. Friends. It's people that we interact with at the local ball game, at the Little League, or at our places of worship. And we need to understand that it is an illness. Stigma is a major problem impacting this. I mean, no one would say, boy, you're weak because you're getting blood pressure medication, or you're getting your cancer taken care of, your heart disease, or the like. And we need to make it just as acceptable and respectable to go get the help you need for your addiction problem or your mental health problem. And that's where our organization, the Detroit Wayne Mental Health Authority, is there to help. We serve over 76,000 people in this community. People with serious mental illness, people with substance use disorders, and people with intellectual and developmental disabilities, providing the support and the help to get them on the road to recovery. We know when the help is there, it can make a big difference.
Absolutely. Just Robin Williams, when he died, I was flabbergasted by something that I read, and it said he was only one of 108 Americans that day, military individuals, veterans, that attempted suicide or succeeded in attempting suicide. So it is definitely something within our realm that we need to focus on and put a face to, and something that we need to accept and deal with. But what are the symptoms? What do you look for? It starts at an early age, within adolescence, adulthood. What do you look for if you have a family member and you're not quite sure what's happening? What are the telltale signs?
Well, let me talk about it from a very personal point of view. I've lost 2 siblings, 2 brothers that suffered with mental illness and alcohol and substance abuse addiction, that took their own lives. I saw the difference that it made when they were ready for the help and when the help was there for them. I saw them soar in their lives, 2 wonderful human beings that suffered because of addiction and mental illness. It's real personal to me. So what do you look for? Change in behavior. Someone that used to be happy that all of a sudden is sad. People that were engaged that are isolating themselves. There's ways that you can help.
So is it an onset, or is it something that's a continuous thing?
Part of the issue, I guess, was saying is it's hard to give one specific, because there's different mental illness. There's manic depression, which is kind of the highs and the lows. The depression, that deep, sinking feeling that nothing is going to get better, that you can't envision a way to get out of it, a darkness that hovers over you in such a debilitating way that it's not just a temporary, we all get down from time to time, but it's that sinking feeling where you feel like a ball and chain is holding you down and can't get up. There are other issues in mental illness, schizophrenia, which tends to hit in early adulthood, 18 to the early 20s, where all of a sudden the change in personality and begin to hearing voices. Can you imagine the pain that it would be to have a voice in your head telling you to do things? And try to get through the day, with that voice in your head. And that's some people. But we know with the right medication, with the right support, and the right treatment, people can move on that road to recovery and can get better, can be an active participant in all the great things that this country affords to any citizen. And that's what we're about, moving people out of state institutions back into their community, integrating them in their community, not trying to define what they should have, but asking that individual, what do we need to do in order to support you so you can be an active participant in your community?
And I keep going back to Robin Williams. I mean, he was the funny man. He was the one who, always made people laugh. Somebody who you thought people wanted to be around all the time. Yeah. Someone who had it all. And you know what? Watching him in some of the movies, his more serious roles, I did see that intensity, and I just seen the two different spheres on the opposite end, and I thought that was amazing. But I knew that he had to feel it inside too, that sense of seriousness or lack of the comedy there, and it was so evident. But how can someone like that hide those senses?
One of the things it shows is that, and Robin Williams spent a little bit of his time here in Oakland County. He grew up here in Michigan, and so most of us who watched him growing up as young people and as adults, could see it. Think of the genius that the man must have had in order to have the addiction issues with substances, have a serious depression, and able to overcome that. But it also reinforces that there are many Robin Williams. They're working in our places of businesses today. They're not the genius. They're not making the $1 million per movie. But there are people working at our local grocery store, at the factories, that are working in blue-collar and white-collar jobs that do have struggle with mental illness, do struggle with a substance abuse disorder. And yet, if we can get them the support, the help they need, they too can have those genius in their own way, and be an active participant and a protective member of society. We're at a place in this country that we cannot waste one child. We cannot waste one adult. We need to have everyone to be productive if we want to have a great city, a great region, a great state, and a great nation. And that's why it's so important that we invest both as a community, as a family, and as a government in these programs in order to help people along the road to recovery. So
how do we do that? Sometimes it's a matter of economics for these people to get the help that they need. So where do we send them? Where do they go for help? If someone does know that they're depressed and they want to get help, or if someone else realizes that they have a loved one or a friend, where do they go for help?
Anybody can call our toll-free number, 800-241-4949. 800-241-4949. 24 hours a day, 7 days a week, 365 days a year. Help is there. So people can reach out. It's a intake referral process. People will provide the help the person needs. If they need immediate help, that help is there. If it's about a referral to see somebody, a therapist the next day, help will be there for them. This is what the Detroit-Wayne Mental Health Authority is all about. Reaching out, and we have community-based programs throughout Detroit-Wayne County. So it's not like you have to go to a central location. We are out in the community providing high-quality care to people with serious mental illness, intellectual and developmental disabilities, and substance use disorders.
Are there charges for this, or people can, how does that work for
Typically, an individual would come in. We have a number of funding sources, the federal government through Medicaid, the great support that we had from Governor Snyder, who quite honestly stepped up when other Republican governors weren't, and helped pass what's referred to oftentimes in a derisive way as Obamacare or Medicaid expansion. Here in Michigan, we call it Healthy Michigan. The legislatures in Detroit, Wayne County, with the support of the governor, passed that law, and now we provide health care, including behavioral or mental health care, to people. So in essence, they have an insurance. And the individual would qualify for Healthy Michigan approximately $16,000 a year in income. If you make less than that, you would qualify as an individual, and it's approximately $33,500 for a family of four, that you would qualify. And then you have an insurance card in your pocket that can pay for these services just like anyone else. There's limited state funds, what we refer to as general funds, available to cover people that don't, and there's some sliding fees in order to help people in other ways. So either your personal insurance, traditional Medicaid, Healthy Michigan, Obamacare, and a limited general fund, and a sliding fee scale for those who have some ability to pay for these services.
So there's
ways to get the help you need.
You know, I want to share a Facebook post from someone who is suffering from this condition, and I read it again and again, and I thought, you know, this is really profound, and the way this individual put this information together was just very, very touching. But she said, you know, after Robin Williams' death, she says, as someone who deals with severe depression, I do not think most people understand that it has nothing to do with your success or security. It is chemical and usually has a component of low self-esteem buried below the surface, just waiting for you to get hungry, to get lonely, or to get tired. Lack of sleep can trigger it. We are soulful, but oh so fragile. The humor makes us appear stronger than we actually are. Alcohol and drugs make it worse, even though people self-medicate with them. That dance or fire between the depression and the creativity is a dangerous one, and most of us get too close to the fire.
Yeah.
And I thought, that's it in maybe 8 sentences in what somebody goes through.
And what that goes to show is the brilliance to put that together with somebody who has a chemical imbalance that it is a disease of the brain. And again, one of the major things that we need to do in this community is to break down the stigma. This is not a weakness. This is something that impacts people over there. It impacts all of our community, black, white, rich, poor, suburban, city. It doesn't matter. It doesn't matter what your ethnicity is. This is a disease. And just like heart attack or stroke or anything else, we need to enable people to reach out and get the help they need. And if they do, they can live a very productive and helpful life.
And it's the understanding too, and I love what you said in that we have to take care of, you know, the neck up as we do, you know, the neck down in terms of physically speaking. It's a chemical imbalance, and I guess there's some research that shows there's a certain gene that's affected, and when it's chemically altered, it creates that sense of depression.
And that's one of the things we need to be doing more research about these diseases, because they impact far too many Americans across this country. And when we lose that productivity, when we see the genius again of Robin Williams go away, the old oil commercial, you can pay me now or you can pay me later. If we invest in the research early on and to try to get to the answer to some of these vexing problems that impact far too many of our community, I think it pays off in the long run. And so I'd like to see, primarily at the federal level, but also at the state level, that we reach out if you're a wealthy individual that's researching this. There's ways. The University of Michigan has a depression center. Eric Hipple, the former Lions football quarterback is a very active member in that, and Heinz Prechter, who is a very prominent member of our community, and his wife, Wally Prechter, his wife is very active. Mr. Prechter took his own life because of depression, and she's very active in supporting the
awareness,
the research at the University of Michigan, the Depression Center at the University of Michigan, and she's committed herself in order to invest public and private dollars to try to get the answers to this, that deep dark secrets that impact the brain. And again, here in our local community, Mr. Prechter was a genius, a person that did so much in the business community and gave so much back to the community, suffered with this debilitating illness called depression for years, and a number of years ago took his own life, and his wife has picked up that mantle and is investing in our community. We've got great leaders like the mayor here in Dearborn Heights that care about the community and are constantly looking at ways that we can invest in all the citizens of our great communities.
Absolutely. Really quick, medication without therapy. Is that like just half of the?
It is half. I mean,
it has to go hand in
typically,
hand.
I mean, sometimes, obviously, we don't want to medicate people any more than they need because there's side effects to any medication. But it really is a cocktail, if you will, with the appropriate medication, with the appropriate support, and that support can come from our community, our family, and our friends, as well as professional therapeutic support, can make all the difference in the people's lives. I saw it when my brothers were ready, willing, and able for the service. And when our community was ready in order to provide the service to them, they lived productive lives. And sadly, in my own home, 2 great brothers suffered from this disease and took their lives. And that's the way I look at it. It is that it's not a statistic, it's not a budget number.
No, it's personal.
It's somebody's family member.
Absolutely.
Somebody's little son, daughter, mother, father, aunt, uncle, somebody that loves them, and that's why we have to reach out and assure they get the help and the support and the care that they need so they can add value and make a difference in this world.
You know, you said at the beginning, we don't judge anyone that's taking care of their heart condition or their blood pressure issue or their cancer issue. So this is what needs to be the message, in that this is nothing to be ashamed of. This is a chemical imbalance that needs to be addressed just like every other physical condition.
Absolutely.
And people need to go out there, and if they're feeling this in this deep dark place and they feel there's no way out, there is a way out. They can get some help, and they can call the Mental Health Authority, and we'll have a couple of other numbers up there on the screen as well, so people can actually call out and ask for help. And one of the statistics too that I read, 1 in 4 people have dealt with mental illness in the last year, and 1 in 17 has a serious mental illness. And so this is something that needs to be addressed. And if you are one of those individuals that feel that there's no hope, there is hope. Make a phone call, get some help. It's a chemical imbalance. It's nothing to be ashamed of. It's something that we all deal with sometime in our life. So it's just reaching out and getting the help that you need. So please do that. September is National Suicide Prevention Month, and let's all be aware of that. And if we can, let's donate to the research to make this debilitating disease more well managed and give the support that individuals need with mental illness. Dr. Tom Watkins, thank you so much for shedding so much light on this timely concept, and we hope that if you're watching, please call and get that help that you need. The world is waiting for you. Put that smile on your face. This is Community Connection. We'll see you next time.